Hello, I am Dr. Abhilasha Baharani. I am a cataract surgeon at CFS Neore Retina Eye Care Institute, Hyderabad. Today I will be talking to you about cataract. What is cataract? So cataract is not a layer on front of the eye. The human eye has a natural lens. The natural lens is transparent to light and it allows the light to be focused on the retina. However, with old age or with diseases such as diabetes, the protein of the natural lens becomes degenerated and forms clumps. Now it is no longer transparent to light and it does not allow the light to be focused on the retina, and the patient experiences blurred vision. So this is cataract. So cataract is opacification of the natural lens of the human eye. Now, how will you know that you have cataract? See, when your vision is blurred, you should go to an ophthalmologist and get a detailed evaluation done, including a retina checkup, and the ophthalmologist will tell you whether you have cataract or not. Once the cataract is diagnosed, we have to proceed with the investigations to plan for cataract surgery. So there is something called as A scan or IOL master, which is nothing but a biometry of the eye. We take a measurement of the eyeball and accordingly we decide which lens will be suitable for the patient. So once the cataract is removed from the eye, another lens called intraocular lens is implanted during cataract surgery. There are different types of intraocular lenses. The broad categories are monofocal intraocular lens and multifocal intraocular lens. Monofocal lens, as the name suggests, focuses the light at one single point, at a distant single point. So monofocal lens gives clear vision for distance. For intermediate vision and reading, near vision, the patient will require glasses. Multifocal lenses redistribute the light at different focal lengths and patient is largely free of spectacles. So monofocal lenses give clarity of vision at near, intermediate and far distances. Now, what is the difference between a monofocal and a multifocal lens and how to choose the lens? So monofocal lens does not compromise the contrast. It gives clear vision for distance. Multifocal lenses give clear vision. They make you largely free of spectacles, but because the light is redistributed, the same amount of light that enters the eye is redistributed at different focal lengths, the contrast sensitivity slightly comes down. Therefore, in dim light, the contrast sensitivity might be reduced. Now, how do you choose? How do you know whether you are suitable for a monofocal or a multifocal lens? This you have to discuss with the ophthalmologist. The broad guidelines are patients with glaucoma or retinal diseases like age-related macular degeneration or diabetic retinopathy. Such patients are not suitable for multifocal lens implants. There is a third category of lens called toric lenses. Now, toric lenses are used in patients with high corneal astigmatism, patients who have a cylindrical power. That means the curvature of the cornea is not uniform. At one axis it is steeper and the other axis is quite flat, and if a normal monofocal or a multifocal lens is implanted in such patients, there will be residual cylinder which will give distortion of vision. So in such patients, specialized lenses called toric lenses are used, which correct the astigmatism that is there in the cornea. So this also the ophthalmologist will make you aware once you get the A scan done. I'll briefly talk about the cataract surgery procedure. So once the cataract is diagnosed and the A scan is done, you can take a date for the cataract surgery. The common investigations that are done are ECG, blood tests like viral markers and blood sugars. Once these tests are normal, you can come on the day of surgery. On the day of surgery, you can have breakfast and come to the hospital. Admission process is done and the patient is sent to the ward. In the ward, dilating drops are used to dilate the pupil, and after about an hour, when the pupil is dilated, patient is taken in for surgery. The surgery is generally done under topical anesthesia. That means anesthesia is given in the form of eye drops, and it is a painless procedure. The procedure generally takes about 10 to 15 minutes and patient can walk out of the operation theatre. And you are in the ward, sister will apply antibiotic eye drops, post-operative eye drops, and the patient is discharged on the same day. The restriction of activities, patient should not have head bath for 1 week. The water should not enter the eye, patient should not swim, patient should not go to the kitchen for cooking. That's all, but routine activities like walking and watching television can be resumed on the first post-operative day. Vision generally clears within 1 or 2 days. So cataract surgery is a highly successful surgery, and I hope this video will be helpful. Thank you.
Follow Center for Sight and post your queries to get answers from the experts.